regarding the burn material. Always feel free to email me if you do end up having extra questions.
I do have a gift kit for the burn. I'll post some gift kits. Whatever I have, I'll post it for you guys so you can
Okay.
do some of this. They helpful? Okay, good.
Yeah. And then for everything else on, I guess have on the outline basically, are all similar, if not the same questions that you have seen. You have seen these questions before, so it really is just a easy review. The only thing that's different is that the PVD and the PAD ulcers were not on the test. You do have, there's 2 questions on those on the final review. Pretty much what I stated in the outline, know the definition, the basics of what those wounds look like, the PVD versus the PAD.
Wet and dry.
So you guys do need to know right-sided heart failure, clinical manifestations, all those symptoms. There's 3 rhythms on the exam, very basic arrhythmias. You just need to know like symptoms, what you need to do for those arrhythmias. Does anyone have specific questions? Any specific questions? So, Lipitor.
Is there MedMap on this one? I'm sorry.
So what?
MedMap.
MedMap. Is that on the, is it not on the outline? I don't think so.
I think we have meds at the bottom that we need to
If
know.
it's,
That we need to know.
I don't think there's any specific map on the, if it's not on the outline, it's not on the,
We'll figure it.
so like for Lipitor, you guys need to know what foods to avoid when taking that medication. What fruit is common, like commonly adverse with a lot of blood pressure medication. Yeah, grapefruit. What? Yeah. Like, avoid grapefruit. What does it do? No. What does Lipitor do? Lipitor. Exactly. Know the signs and symptoms of Lipitor to look out for. That it could be that's a select all let apply question. The angina. Know the different types of angina. Like what's unstable angina? What is that?
It doesn't go away at rest.
Very consistent and predictable. You need to know what nitroglycerin does. What are you educating a patient that's taking nitroglycerin?
Your tongue could tingle. You could get a headache. Don't take it more than 3 times. You always need to go to the hospital if you've taken it.
It reduces chest pain. Yeah. And then know that pathophysiology of that medication. Like, how does it reduce chest pain?
Vasodilator.
Yeah. Decreases the ischemia of the myocardium because of its vasodilating. So you need to know all those modifiable risk factors for coronary artery disease. What's a very common complication after surgery? Also specifically for pacemaker implantation.
Infections?
What else?
Bleeding?
Yes. Yep. So I have bleeding at the site. Like I had witnessed a patient. It wasn't my patient, thank God. But when a patient has a new pacemaker implant, never have them pull themselves up in bed or lift anything heavy, because when that patient pulled himself up in bed, his site tore open, so he had to go back to ICU. So yes, monitor for bleeding, especially. So what's the therapeutic effect of Plavix?
trade name.
Clopidogrel.
It's oh my god. It's not a slower, is it?
Yeah, prevents thrombus.
Oh, it's like prescription aspirin, right? Okay.
Different, they're different.
Sorry, not it's yeah, it's different. It is an anticoagulant. Main goal is to prevent thrombus formation, especially after your patients that are going to the cath lab after stent placements.
I want you to think of it as being different because you will give a patient both medications. I don't want you to think that they're the same and you're like double downing on them. The aspirin works differently in the coagulation than the coagulation
Okay.
cascade than the
Okay.
clopidogrel does.
Okay.
But they both help prevent thrombus, just in different ways.
Okay.
A lot of the questions are basically if you see like what is a highest priority in this assessment of this patient, you just have to know the abnormal, like what's the answer that's abnormal that you're concerned with. There's really nothing tricky about a lot of these questions. Like there'll be one abnormal and the others are all normal within normal limits kind of answers. So if you know the abnormal assessments, then you'll do great.
How many select all to apply or on the total exam?
It's on the outline. I can't remember.
18.
The
There
eight,
were 5 for burn.
did I not put it on there? Stephanie, do you remember how many select on the?
I can count them up.
I know five on the burn.
Read them off by I second that. Melissa, you so smart.
I don't think she heard me.
Are you counting?
I think I'm ignoring you.
I think she heard you, Melissa. She kept piping down. No, Melissa, you know what?
I'm trying to be quiet.
For mechanical valve replacement surgery, you need to know what medication that patient is going to be taking and for how long. Mechanical valve replacement surgery.
You said what medicine? How
Yeah.
long?
What? Yeah.
Is it heparin for 6 months?
So for mechanical valve replacement surgery, what's the one like negative implication? Yes, for exactly.
Oh, you have to take it for
Anticoagulants
life.
for the rest of their
Yeah,
life.
that's right. Yeah.
You guys need to know the assessments for infective endocarditis. Like, what are those in the PowerPoint? There's slides specifically, like for what manifestation, like splinter hemorrhages, petechia. Like, what manifestations will you see with infective endocarditis? If you go back on that PowerPoint.
Wait, what was your question again? What did you say? I'm sorry.
The clinical manifestations for infective endocarditis.
Oh, okay.
All those clinical manifestations for myocarditis. Just review the PowerPoints. They'll be on there. Hypoparathyroidism, what diet will these patients be on? Hypo, yeah.
It's either high phosphorus or low phosphorus. I can't remember which is which. I think for hypo it would be high calcium, low phosphorus, right?
You say
Sweet.
Hypoparathyroidism. Yeah, high calcium.
Hi.
You got this.
How many
That
questions are
includes
there?
75. That includes the burns, whatever the burn number is. That's the total number.
For the Endocrine,
I feel like it's gonna be all like that.
if you look in the PowerPoint at the end of the endocrine PowerPoint lecture, those serum chemistries and the urine chemistry you need to know for both the SIADH and the DI. Same questions you've seen before for those.
Dry inside,
Don't
wet
mix them
inside.
up because they're the exact opposite of each other. The serum chemistry and the urine chemistry question, what would the lab results be for those patients? DI and SAIDH.
Dry inside and dilute, wet inside and concentrated.
Like is it decreased urine output, like the same, like decreased urine osmolality, urine specific gravity, urine sodium, the same ones in that PowerPoint.
Okay.
So I'm gonna say what Professor Herman just said a little louder because I think it's important because that's something they should be studying. So diabetes insipidus, SIADH. There's two PowerPoint slides. One has like what the serum looks like what the sodium is, what the osmolality is. You need to be able to see those lab results and recognize if it's diabetes insipidus or SIADH. Does that make sense? The question is not whether it's concentrated or dilute. Yeah, it's gonna ask which is it, diabetes insipidus or SIADH. It's that next step up from what we tested you on, right? It's the kind of cumulative. It's not just retesting the same exact content. It's giving you that next level. But you can do that. You can do this. I just like studying it just slightly differently, but you can do this.
Cushing's disease, know those clinical manifestations.
What are some of the clinical manifestations of Cushing's disease? Moon face, buffalo hump, striator, the stretch marks, yeah. What else? Fatigue, truncal what? Truncal obesity. What's their skin like? Thin, frail, dry, not thick and not buffalo humpy, not buffalo-ish. That's what I always think happens. You're like, buffalo hump, thick skin, right? You kind of like put those two together, but that's not it. Yeah, they have the thin, frail skin. Excellent.
Same clinical manifestations for Graves' disease.
Can we name for Graves' disease? Weight loss?
Weak.
Sorry, I'm only hearing like,
Thick skin.
they could.
The eyes, I forgot what it's called, but the one the eyes.
Exothalamus, yep. The bulging eyes, yep. And what else? Tachycardia.
So it's basically hyperthyroidism is Graves' disease, so hyperthyroidism. And then hypothyroidism, so need to know both. They're essentially kind of the opposite symptoms.
Mhm.
What's the medication you get for hypothyroidism?
Lavoxithyramine.
Yeah, levothyroxine. So, what's the medication you get for like hyperthyroidism, like Graves' disease?
Oh, I can't remember.
Methimazole, PTU. So, what would the therapeutic effects be for that? If for that patient, if the medications are working,
For which one?
for hyperthyroidism, like Graves' disease.
Decreased sensitivity to heat.
Yeah, that's one of them.
Yeah, reduced weight loss or
What
weight
vital
gain.
signs specifically?
Decreased heart rate.
Heart rate?
Yes. Yeah. Reduced heart rate is a huge change. It's a very good therapeutic effect. Because they're going to have very high heart rates. So for a patient in the PACU that just had a hypophycectomy for pituitary edema, what are those orders that you're going to be seeing for those patients, and which orders would you question? Does anyone remember those specific orders
Don't cough.
for hypo? Definitely don't cough. That
Don't
will
cough,
cause.
don't
What happens
sneeze.
if a patient coughs after the hypophycectomy? Yeah. Yep, because it causes increased intracranial pressure and also strains the surgical site.
Which surgery?
The hypophysectomy, it's a removal of a pituitary adenoma.
No Trendelenburg for repositioning the patient.
So nothing that will increase intracranial pressure. You don't want to do that. So no TRAP. The TRAP for the TRAP acronym for Parkinson's disease. Myasthenia gravis. The medication, what is the effect of that? What's the medication that you give for myasthenia gravis? Mestonin. And what's it gonna? What's the therapeutic response in the patients after it's given?
They can chew and swallow? Is that
Yeah,
the
so
right
they'll
one?
have increased muscle strength.
Yeah.
It's increasing their muscle strength. Myasthenia gravis, plan of care. What's the plan of care for those patients? What's the main thing? A big plan of care for myasthenia gravis?
Nutrition?
In the morning.
Yes. Energy conservation. So like, how would we conserve energy in these patients? Like basic little things like electric toothbrush, right?
Electric razor?
Having tools do the work for them. What can a nurse do during a seizure, and what can the unlicensed assisted personnel do?
Nurse can do everything. The licensed person can do vitals and the blood glucose.
Yep, vitals, repositioning. They cannot call the doctors.
No.
Know what an aura is in a seizure event? An aura.
Aura and headaches.
In the
In
seizure.
a seizure.
Yeah, it is similar.
It's like saying I'm about to have a seizure. It's your body
That
telling you.
warning sign.
Yeah.
Risk factors for acquired seizures.
Risk- What, like fever and like that type of stuff?
Risk factors like Alzheimer's, alcohol withdrawal,
Okay.
all those same acquired risk factors, cerebrovascular disease,
Okay.
and that PowerPoint slide, brain tumors. Signs and symptoms of abdominal aortic aneurysm rupturing.
Sudden death.
Severe back, abdominal pain. Yep, that's one of them.
Impending sense of doom.
As well as aortic dissection. So when it's tearing and ripping. So abdominal aortic rupture is when you just have a growing, bulging aortic aneurysm that ruptures versus that dissection, that tearing, ripping. What's the antidote for heparin? Antidote for heparin?
Vitamin.
What does silestazole do? Silestazole for what is that? Yep, for IC, intermittent claudication. So when should a patient take that medication?
In the morning. Right, I'll just test it. I'll just test it. You got it, Shannon.
Burger disease. Oh, did you?
Yeah, are there no questions on headaches?
Burger disease is
Is it not in the outline?
No, I don't think
No,
so.
then there's not. Yeah. I don't think there is. No.
On what?
No.
burger disease is males 20 to 50,
Smokers.
and it's not all fingers. It's just certain extremities,
Lack of-
usually fingers, and they get like lack of perfusion.
Gangrene?
That autoimmune disease.
Yeah.
Recurrent inflammation of those arteries and veins. Does anyone have any other specific questions?
Not off the dome right now, but I'm sure I will.
Okay. Send me an email.
Yeah.
You can remember it
I
later.
think we'll do, we can do an exam review next week. We'll do a Zoom meeting. I will not get interrupted and we'll record it. And, maybe we'll just do Thursday. So then you guys will have your PEDS exam done. You'll have a couple days to maybe get some other studying done. We'll do it like Thursday at 3:30 again. Whatever. What's the date? 1, 2, 3. The 4th? Is that the 4th?
Yeah.
December 4th? I'm sorry. Oh, that's right. Okay. Well, I'll do it at 3:30. So if you're able to jump on with it. Oh, you guys know Pete's?
Yeah.
Oh,
Yeah.
No, I don't know who did that.
Oh,
Yeah.
sorry, y'all. Not me. I will record it. I hear you. Yeah. So we'll plan on Thursday the 4th doing that. I'll send an announcement like soon so I don't forget about it. And the blueprint is what you should follow. Okay? The objectives for the burn lecture, do the objectives for the burn lecture. For the rest of the exam, do the exam blueprint. There's no games here. We're not trying to trick you. The blueprint's whatever's on the blueprints is what is on the exam. Okay? Alright? Historically, students do great on the final. It's a lot of review. So, yeah, I anticipate the same for y'all.
You guys do not need to know the Landon Browder chart on the exam. It is in the blueprint because you will have to know for
Like, if you
in-class.
saw London Brower, you could be like, oh, I think that was in the burn lecture. That's
Yeah.
enough.
Yeah.
Okay? But you're not going to be doing burn, like, you're not
Or
going to
not on
calculate
the
someone's
exam.
burn.
Yeah, the ninth. I think
Sorry.
No, tell her Melissa.
Very surviving. No.
What's up?
I wanted to say thank you for